So I want to talk about potential pushback from some people that might feel like I'm trying to shame them for having had surgery in the past or are on opioids or have received injections. I'm not here to make people feel bad about that. I'm here to open people's eyes to the fact that most clinicians are not trained in the understanding of pain. Most physicians do not receive pain training. And so the way that they go about approaching is offering those pills and the injections or the surgery, and they really feel like that is what people need because that's what they were trained to do. And the intentions are there, and I'm not here to even shame the clinicians that are doing these things. However, I feel like all of us should have enough of an open mind to understand that there's a lot of ways, including education, which is critical because how you're interpreting that pain as being a concern is what's going to draw you into the medical system to begin with. So if I'm able to self-manage my pain, the medical system doesn't even put me into the statistics because of the fact that I'm finding a way to deal with it on my own. So there are plenty of people out there that have developed skills on their own, have been guided into those skills, but there are many people that have jumped into opioids or injections or surgery because they were offered that, and this well-intentioned practitioner is giving them that option. And when people are desperate, they're in pain, and they need help, they will go to the next opportunity. But I will tell you that there are people that are probably on an injection, serial injections, or in taking opioids frequently, needing to have them all the time or feel like they need them all the time, that really have not been given the right education or the skill set to even believe that there are other ways to help their pain. But if they feel like they get 10 to 20% relief from those opioids, then that's the only belief of skill or belief of possibilities to help them. So I just want to open people's minds up that there are other ways of managing it, and it takes several things, including how you're thinking about things, the skill set you have, the things that you can do cognitively, psychologically, also just physically. But it's a constant evaluation process and takes a lot of patience and the right kind of guidance from other people in the medical field if you're having trouble doing it on your own. So I'm not here to shame anyone that's currently on those things. I just want people to have hope that there are other ways of dealing with pain and that we shouldn't jump too quickly because our bodies are resilient. They're brilliant and they're completely adaptable, whether it's in a positive or negative direction. So if you are on some medication and you're wanting to wean off, you got to have the skills to give you the belief and the confidence so that you can come off those medications with a knowledge and skill set that allows you to feel the freedom and independence not to depend on the medical system for the rest of your life. So I just want to remind you that I'm not here to shame you. I just want to inspire people for those that have never gotten those interventions that might be looking at potentially needing some of those interventions and realizing there might be a better way. And hopefully those that are getting those serial medications or injections or surgeries, sometimes several surgeries, might be able to step back and reevaluate their situation.